Cases of the bird flu are rising across the U.S. and today the Hamilton County Health Department addressed what's going on with the disease and if we're seeing it here in the Tennessee Valley.
Our Dallas Payton has this story.
Bird flu is a type of influenza A that is typically found in wild or domestic birds. However, for the first time this year, it was found in dairy cattle. The bird flu was first found in dairy cattle down in Texas and then Michigan. Also in Michigan, there are a few human cases. 3 farm workers in direct contact with dairy cattle became sick.
This virus, it makes cows sick. It's found in raw milk. So we continue to advise people not to drink raw milk because you can get sick not only from H5N1 but other viruses and bacteria. Also, just keep monitoring yourself for symptoms of any kinds of illness, and if you do get a respiratory disease, use protective measures as you always do.
Dr. Don Ford with the Hamilton County Health Department says the FDA reports that commercial milk is still safe to drink. Also, as of now, there have been no cases reported in Tennessee.
We are just monitoring the situation. We are continuing our flu surveillance throughout the summer when normally we stop in May. And this is to help the state and the CDC to monitor flu in case it does become human-to-human transmissible so that we can detect it as soon as possible.
Dr. Ford says wastewater testing is being done for the bird flu in a few states across the country, including Tennessee.
And within Tennessee, Chattanooga and Memphis are the 2 areas where they're doing wastewater surveillance. It has not been positive yet in Tennessee.
Wastewater in states like Minnesota, Idaho, Texas, and Michigan tested positive. Dr. Ford says there's no certified dairy farms in Hamilton County, so the risk is slim, but other counties in the state are being watched.
There's over 170 certified dairy farms in the state, and they are working with Tennessee Department of Agriculture to monitor as needed. And then they ensure that their farm workers are taking precautions because right now it is the farm worker that is most at risk at contracting the disease.
For Local 3 News, I'm Dallas Payton.